My name is Eva Nilsson Bagenholm. I'm the National Coordinator for Elderly Care at the Ministry of Health and Social Affairs in Sweden. I'm a doctor and I'm working with the Ministry now to improve elderly care. There are some different policies, but what we are working with now is to have integrated care, both health care and social care for the elderly. And we are working to improve the possibilities for elderly to stay in their own homes as long as possible and to receive good health and social care in their own homes. So the main purpose is to improve the quality of life for the elderly and the possibility for the elderly to live in their own home as long as possible. What the costs for care are high in any way you do it, because elderly people have different diseases and many diagnoses as the older you get. But we know that the best way of treating people is to prevent them to be acute ill and prevent them from needing to come to the hospital, because hospital care is very expensive. And at the hospital you can actually receive infections. Maybe you will get a little bit confused and have a fall incident, or you will have a fracture when you come to the hospital. So there are different things that we want to prevent the elderly to receive when they come to the hospital. So we want them to have better care in primary care and in specialized open care. And that is better for the elderly and it's less expensive for the society. Big place to use IT solutions in both elderly care, the social part and the medical care. A lot that we have been doing is the communication for the elderly. For most persons that are getting old and they have a lot of diseases, still they are living in their own homes for the most part of the days in the year. Maybe just a couple of days they're in the hospital. Otherwise they have to be able to cope on their own in their own homes. So then you have to have a good possibility to communicate with the staff, both social staff and medical staff. And what we have put up is internet solutions where the elderly person can communicate with the municipality on a very easy way. They have to have internet solutions, but they don't have to be able to use a computer. We have simple solutions where they can communicate with the staff, and the staff can remind them of taking their medication, and the person itself can ask, when am I going to the doctor, what am I going to do now, and so forth. So a lot of communication between the staff and the elderly. And also they have put up social networks for the elderly. So elderly people that are alone, live in their own homes and are maybe not possible to go out as much as they would like to, they can communicate with other elderly persons in other places through the social networks. So there are different communication solutions that we are implementing. Well, it takes time to develop, but I would say it's not a technical problem really. It's more of a habit. You have to get used to using the IT solutions. And also when it comes to assistive technology, things that can help the person, for example, different robotics systems that could use them in their own home. For some person there is they think that they could not use it and they are afraid of using it, and also the relatives are a bit afraid. So you have to communicate and explain why this does not take away the personal communication. It's just an add-on. It's something more. You get more of communication possibilities and help with the IT solutions. So it's not taking away the interaction between two human people, it's adding on, it's something extra for the person. It's difficult to form an organization for the patients because the elderly, they are fragile and it's difficult for them to set up an organization. What we have seen, it's easier for younger persons to have a patients organization. So we have to work with them on a personal basis. When it comes to the different municipalities in Sweden that are responsible for the IT solutions in the homes, they are very different from each other. Some are very mature and they are using IT very much. And they even call them e-municipalities in elderly care. And some are not using it at all. And I think it's because of the people that are working in the municipalities. If they are a little bit hesitant or afraid of using IT, then they will not offer it to the elderly. So we see from the municipalities that are using IT a lot, it is spreading. So we hope that some municipalities will be in the front and they will lead the way of using more IT in social and medical care. Yes, we work with patients' organizations and mostly the people that are working in the patients' organization are younger. So the challenge for us and when we work with the elderly is that they are not as much organized in patients' organization as the younger are. So maybe it's not the same for a person with diabetes who is 30 and who is 80. So it's not always that the patients' organizations are working with elderly issues. So it's a bit different. We are working a lot with organizations for pensioners, people that have retired. They have strong organizations in Sweden and they are really working a lot together with us.